Hi, my name is Alyssa Parker, and today I have chosen to present information about self-harming, a fast-growing phenomenon that has spread throughout high schools and college campuses across the country in recent years. So what is self-harming? The basic definition is an intentional act of causing physical injury to oneself without wanting to die. These intentional acts can be inflicted through a myriad of different ways. The most commonly known form is self-lacerations, which typically demonstrates through cutting on their arms, legs, or the front of the torso. Other methods include scratching, hitting yourself, intentional drug overdose, driving at high speeds, unsafe sex, and self-poisoning. This by no means is an exhaustive list, since there are endless ways of self-harming, but this tends to be the most common that we see. So what is the origins of self-harming behavior? During the Middle Ages, self-flagellation, a religious ritual that means to purify oneself that involves lashing their backs with small whips. This rite of passage was meant to either drive out evil spirits, serve as a resurrection ritual, or to symbolically represent the whipping of Christ before his crucifixion. Aside from the biblical references related to self-harming, discussions and conversations on self-harming have been pretty minimal over the years. This is largely due to the negative stigmas attached to those who self-harm. Those who struggle with this issue have historically kept silent about their struggles, and as a result, there is a lack of information and research on this topic. It wasn't until the 1990s that we first hear about it, outside of the religious context anyway. And during the 80s and the 90s, the cultural expectations for women to have thin bodies through extreme fitness began. A side effect of this obsession began the rise of anorexia, bulimia, and self-harm, especially with adolescents and emerging adults. So how common is it among adolescents? Researchers have found that on average, 20% of all high school students and 40% of all college students have harmed themselves at least once. It is also reported that 6 to 7% of all students are currently self-harming or are chronic self-harmers. This often begins in secondary school during mid-adolescence. The period in which adolescents will self-harm can range from just a few months of self-harming or begin in middle adolescence and go all the way into adulthood. The research estimates around 15 to 70% of college students self-harm frequently, which shows that it's still prevalent during college. Over the years, these incidences of self-harming have only increased. From 2011 to 2014, a 37.4% increase was reported for all girls and a 12.3% increase for boys. Girls between ages of 13 to 16 had the sharpest increase at 68%, which is a trend supported additionally in the graphic that you'll be seeing in the next slide. So when we try to look at who is self-harming more, males or females, the research points to females. In a study conducted in the UK, it determined that girls were 3 times more likely than males to self-harm. Here in the graphic, if you look, it further explains these differences between males and females with regard to self-harming and age. This same study, conducted in the UK, examined over 16,000 patients, ages ranging from 10 to 19, who had reportedly self-harmed anytime between the years 2001 to 2014. So in the graph, you can see that the age group which reported the most incidences of self-harming with females came from late adolescence. However, in the last few years, you see a spike in females in the mid-adolescent stage, which surpasses the reported incidence for late adolescents. With males, you see a higher percentage of incidences with late adolescents across the board. The study also found that self-harmers were 17% more likely to commit suicide at a younger age and 34 times more likely to die from an overdose at a young age. So in other words, self-harm can be the gateway drug to suicide, which is why it's so important to intervene and stop the behavior as soon as possible. So, what are the risk factors for adolescents? And it's important to identify those risk factors which are associated to self-harm so that we can correctly develop a treatment plan for it. So the first risk factor that I wanted to talk about is age. Who are those who are most at risk or prone to self-harming? As we saw in the previous slide, self-harming typically begins during mid-adolescence and can routinely go throughout their 20s. And then the numbers kind of taper off after college as far as how many are participating in that in adulthood. So another risk factor is having friends who intentionally harm themselves can increase the likelihood of an adolescent experimenting with self-injury. So many times I saw this phenomenon referred to as the yawning effect, where teens see their friends and media depictions of self-harming and try it themselves. One of the biggest risk factors centered around what is happening is in an adolescent's life with their friends, their family, or themselves. Examples of this stretch far, ranging from low self-esteem, perfectionism, to those who are more impulsive. Also, those who are struggling with their sexual orientation or has a family history of violence or dysfunction are also at more risk or higher risk for self-harming. Social isolation is another factor that has been studied extensively, determining that those who prefer isolation are more prone to inflict self-harm. Mental health issues involve a history of psychiatric disorders within the family, depression and anxiety, as well as those suffering from borderline personality disorders. There is also a strong connection with excessive drug and alcohol use and adolescents who self-harm. So it's important to look at this list and understand how these risk factors affect the adolescent and how self-harming somehow helps them cope with these factors. So for this presentation, I broke down the main various types of treatments that are most common for self-harmers into three main categories: self-help, pharmacological, and psychological treatments. I want to talk about each of these individual groups so we can talk more in depth about what each treatment has to offer. Self-help is for those who are wanting to first address the problems on their own of self-harming, which a majority of self-harmers prefer. There are a variety of resources available, both good and bad. The internet, for example, can be a great resource for finding helpful, credible, and reliable treatment options for those who self-harm. It can provide tips and tricks in dealing with the behavior. However, there are also plenty of websites that provide misinformation and inaccurate advice. So I want to focus on a few examples of trusted online resources that have created online programs for self-harmers to visit. And the first one is BUS Central, or Bodies Under Siege. It's an online group that gives free access to their resources, materials that promote alternative coping strategies for self-harmers. The other website I wanted to talk a little bit about is Bristol Crisis Service for Women, which is based outside of the UK, and it's become kind of a central location or a one-stop shop for self-harmers and their families and friends who are looking for support. They have self-help programs, ideas, they have educational tools and lesson plans for self-harmers. And then the last one I wanted to highlight is the Safe Alternatives website. So SAFE stands for Safe Abuse Finally Ends, and they have a few physical facilities that offer treatment centers for those who self-harm. But because of the dramatic increase in the amount of people who are seeking help and treatment for self-harming, they have basically had to shut out so many people from coming that they've expanded their program into shorter online versions, as well as publishing a self-help book, which I'm going to talk about again right now when we talk about other alternatives outside of the internet. There's also a large available choices of different books that are available. Bodily Harm was done was written by those who started the SAFE organization. It's called Bodily Harm. And another book that I found to be incredibly helpful was called Freedom for Self-Harm. But really, there are so many different book options that are available online. But I found quite a few just in my local public library that were free resources that I found were really helpful. So when we move on to pharmacological treatments, I want to go over a few of the most popular types of medications that are most commonly used to treat self-harmers, but it's important to point out that medications is by no means a quick fix. Most studies shows that pharmacological treatments, as you will hear, are not typically effective when exclusively done to treat self-harming behavior. So the first one is antidepressants, which act as a mood stabilizer, which then make it a possible option for adolescents who self-harm derived from their depression or anxiety. By addressing these issues, patients can potentially decrease their self-harming thoughts or actions, but 3 trials have indicated that the newer generation of antidepressants have no specific overall effect, either positive or negative, on reducing repetitious self-harming behavior compared to the placebo group. Next is antipsychotic drugs. And the rationale for using the antipsychotic drugs in treating self-harming is to reduce the heightened arousal adolescents feel as a result of living in a state of elevated stress. So by reducing the arousal, the need for self-harm is possibly reduced. There was one trial that was conducted with patients that had a repetitious history with self-harming and found considerable benefits in comparison to the placebo. Next is mood stabilizers. Mood stabilizers are typically used with patients suffering from bipolar disorder or unipolar depression. Many speculate if the mood stabilizer lithium, with its ability to prevent episodes of mood disorder, could also reduce in suicidal behavior, thus possibly reducing self-harming behavior. The results are still inconclusive, though, and it is clear that more research needs to be conducted in order to ascertain the effectiveness of this specific treatment. So overall, the trials suggest that pharmacological treatments are, for the most part, ineffective in treating self-harming behavior. Again, there's no medication to specifically treat self-injuring behavior, so it isn't a cure at all. Pharmacological treatments are beneficial to those who are dealing with mental health conditions like depression, anxiety disorder, or mood disorders, and medication for these disorders may help alleviate the need for self-harming, but it will not solve the problem completely. The most important thing a self-harmer can do initially is to get a psychological assessment done with a mental health professional. So this assessment can help guide the provider to determine which types of psychological treatments would be most helpful. The most common type of psychological treatment for self-harming is individual therapy, which is often described as talk therapy. Individual therapy is available through inpatient hospitalization or treatment facilities like the SAFE program, which is typically done only in extreme circumstances. There's also partial hospitalization, which is usually done when someone is transitioning between inpatient and out. And finally, outpatient treatment, which is the most common and most flexible type of individual therapy. So here's a list of a few different types of individual therapy that are most common in treating self-harming. The first is cognitive behavioral therapy, which helps you identify unhealthy negative beliefs and behaviors and replace them with healthy positive ones. It is a structural process that helps patients manage their thoughts and their behaviors better. They are often given homework assignments to practice during the week and bring back at their next session. And then the next one is dialectic behavior therapy, which teaches a lot of the same things that the cognitive behavioral therapy teaches, but adds an additional component for learning self-acceptance. And then we have psychodynamic psychotherapy, which focuses on identifying past experiences like hidden memories or interpersonal issues at the root of your emotional difficulties through self-examination, which is often guided through a therapist. And this basically helps the patient identify what drives them to self-harm in the first place. And then next we have group therapies, which can be both supportive therapy with individual therapy or the primary source of treatment. depending on the needs of the individual. But group therapies can be structured in a few different types of ways, depending again on which needs the patients have. So the first is a psychoeducational group whose main purpose is to give educational information to help identify risk factors, the side effects of self-harming, and how to cope with stress. This group is ideal for those patients who aren't knowledgeable about self-harming and need a base level of information. Next is skill-oriented group, similar to dialectic behavior therapy, in that this therapy also teaches you to be present in the moment, as well as stress management and interpersonal relationships. And this group session is often kind of described like a class that meets and teaches skills rather than share experiences with one another. And then finally, you have the process-oriented group, which focuses on sharing personal experiences, emotions, and relationship problems with family and friends. There's a group leader that usually facilitates and helps the discussion move along and keeps the session focused on learning about the process that they're each going through. And then finally, you have family therapy, which is an option for adolescents whose family maybe have dysfunctional issues or just need to learn to communicate and understand each other better, and family therapy can help facilitate that. So in conclusion, it's clear to see that there are many different resources available to teach adolescents who are struggling with self-harm. Through these risk factors, the risk factors are vast, and the reasons for self-harming may vary significantly. But working with a healthcare provider to find the best custom treatment program to address has shown to be the most successful way. So there is hope, but it's more important to look for the warning signs and intervene somehow before it escalates into something more serious like suicide. Thank you.